COVID 2020. The Chief Health Officer is here as well to take any questions you have. Can I just make the point, well, we're happy to answer all questions, but we do have to get to Parliament this morning. So if we could just bear that in mind, that would be very helpful. I can confirm that there are 186 active cases of coronavirus in Victoria. That's 12 new cases since yesterday's update. Of those 12, 2 are confirmed as linked to known outbreaks or existing cases, and 9 have been provisionally linked to known outbreaks or existing cases that are being actively managed. Investigative work's ongoing to confirm that, and we'll provide more details in the Chief Health Officer's release later today. So essentially 11 of those 12 are being managed. They're known to us. They've tested positive within a framework, and that is the public health response working as it should. One regional case, so the last of those 12, is a previously cleared case that has retested as a positive and is under review. That case is in the Geelong area. The Chief Health Officer can speak to that, but my advice is that much like the Mildura low positive, it's a different set of circumstances, but much like the Mildura low positive last week, that'll go through the usual review process, and we don't believe that that person would be infectious, but the Chief Health Officer can speak to that in more detail if you would like. Sadly, an additional male in their 70s an additional person has passed away because of this virus, and we send our best wishes and condolences to that family. That male in their 70s is linked to aged care. There are 23 Victorians in hospital, none receiving intensive care. A total of 2,858,794 test results have been received since the beginning of the year. That's 8,201 since yesterday. Obviously, that's the second of the weekend numbers coming through. We just again thank those people for having gone and got tested, but we again make the point, because nothing's more important. The sooner you get tested once you register symptoms, the safer you'll be, the safer your family will be, the safer every family will be. It's incredibly important to go and get tested as soon as you register those symptoms. Don't delay, don't wait till tomorrow or the day after. Please go and get tested as soon as you have any sense that you've got symptoms compatible with this virus. In broad terms, I might try and provide a bit of an update later in the week about testing and some of the work we're doing in high-risk locations, as well as just a bit of a picture about our aggregate testing performance versus some others. Certainly, the last data I gave you was about 100,000 for a week, which compared to about 50,000 in New South Wales, for instance. So those numbers are still strong. They're well above the World Health Organisation range, if you like, but we'd always call upon every single symptomatic Victorian, please come forward and get tested as soon as those symptoms register. It is incredibly important. There are 16 healthcare workers who are active cases, and we thank them and their colleagues for the amazing work they do. The rolling average to 12 October, Metro 10.0, Regional 0.4. Cases classified with an unknown source, so mystery cases, at the 10th, 13 in Metro Melbourne, none in regional Victoria. The Metro regional split, there's that one case that's under review and may or may not finish up staying a positive for the reasons that I've outlined. That takes the total number of active cases in regional local government areas to 6, but we'll wait and see whether that stays at that number or in fact comes down, pending that panel having a very close look at this particular case. All 5 of the remaining active cases in regional Victoria, so excluding that Geelong case I've spoken about, are in the Mitchell Shire. There are 30 cases still active in aged care, so those numbers continue to fall down. If you like, we shouldn't gloss over the fact that we've essentially no active cases in disability facility settings, a falling number, and a much smaller number than was the case some time ago in residential aged care. That is an achievement that is very important to acknowledge, I think. They are the numbers of the day that I needed to go through. I'm now going to ask the Deputy Premier to go through some very important announcements to support students. This has been an academic year like no other, and both students, parents, teachers and staff, entire school communities have done an amazing job in really challenging circumstances. But there will be, because of absence. There will be because of some of the unique challenges that this virus and the settings we've had to put in place in order to ensure safety. There will be some unique challenges that need to be supported, and every individual student will be supported in their academic journey, and to make some very significant announcements to that end. Not all will do, but a very, very big part of our response to that dynamic. I'll now ask the Education Minister to add to my comments.
Thanks very much, Premier. This is the single biggest boost to individual learning in our state's history. We're dealing with a 1 in 100 year pandemic, and we're responding in an unprecedented way. We know that the vast majority of our kids spent Term 2 and Term 3 studying remotely, and we know that whilst many thrived in that environment, many students struggled, particularly disadvantaged students. For those who have fallen behind, we're going to support you like never before. This is a really big announcement that we're making today. It is a $250 million package to recruit and deploy more than 4,100 tutors to support more than 200,000 students in the 2021 school year. And of those 4,100 additional tutors, we expect about 80% of those will be women, and women have been so severely impacted through this pandemic. It's important to note and to understand this is over and above the existing workforce. Our principals, teachers, support staff have done a brilliant job. This is an additional workforce of 4,100 tutors over and above that team. Every single government school in Victoria will receive funding, every single one, and it will be weighted to disadvantage. That's $209.6 million for government schools to deploy and recruit around 3,500 tutors. For our non-government schools targeting disadvantaged students in Catholic and independent schools, there's $30 million to deploy and recruit around 600 tutors. And there's also a further $8.6 million to recruit a further 16 Koori support workers across our state, and an additional 60 multicultural and multilingual and bicultural workers to support students where English is not their first language. So there will be individual assessments, and I've talked about that before, right through this term as students are back at school. Kids will be individually assessed in terms of where they're at. Those that are further ahead than where they might have been, and those that have fallen behind. In terms of the tutoring itself, it'll be a locally based decision. So schools are best placed to determine how best to deploy these additional tutors. But to give you an example, we're looking at probably 2 to 3 sessions of around 45 minutes with 5 or so kids. So this is small group tutoring, individual support. And all the evidence, international and domestic, shows that this is the best way to get the biggest difference in bringing kids back up to speed. The Grattan Institute released a report that shows that small group tutoring can provide an additional 5 months of learning in just 20 weeks. That is what this will do for kids right across the state. So we need to recruit a lot of people, more than 4,000. We know that they're out there. Currently, there are about 5,500 teachers who are either recently retired or on a long-term leave. There are 4,000 pre-service teachers. There are 3,600 casual relief teachers. We need more than 4,000 of them to put their hand up. So my message to retired teachers, pre-service teachers, casual relief teachers, we want you and our kids need you. And my message to parents and carers, if your child has fallen behind, we will bring them back up to speed. So this is a really important announcement. We'll be recruiting right through Term 4. There is a website up for people to pre-register their interest at education.vic.gov.au. This is an incredibly important announcement, and I'm very happy to answer any questions.
On the recruitment, you said you will start next term, but how long do you expect it will actually take to get it in full swing?
So we want to deploy these 4,100 additional tutors from term one next year. So this will be an additional workforce. This is money that schools must spend on tutors in the 2021 year. This is to get kids back up to speed, because we know the advice is around 1 in 5 would have fallen behind where they would have normally been had it not been for the pandemic. They've struggled with remote learning. So we're recruiting now, and we'll be deploying from term one next year.
And it says that students from non-English speaking and disadvantaged backgrounds are the most impacted. Is there any evidence of age groups specific or genders that are also suffering in terms of these data?
No, the evidence, we'll see more of this as the schools do their individual assessments as kids are coming back from this week. But we knew that disadvantaged kids, vulnerable students, are the most impacted by remote learning. Haven't seen evidence to show that it's a particular age cohort or whether it's more boys or girls. We haven't seen that evidence yet, but we know that disadvantaged kids are the most impacted. And that's why this funding, this rollout, will be targeted, will be weighted towards disadvantage. But every single government school will receive funding support for tutors, and all non-government schools that are eligible will also receive funding.
And will it be split regionally or by metropolitan, given that metropolitan's been in lockdown?
It'll be rolled out according to the size of the school. So it'll be a per capita assessment, as well as weighting towards disadvantage.
So James, will these be full-time ongoing roles, or will they be time limited for a year or two? Or?
This is a 2021 investment, so it's over and above the existing workforce. So we've already got casual relief teachers, for example, that are working 1 or 2 days a week or a fortnight or a month. We want them to put their hand up to do more work. We want teachers who are on long-term leave to say, I can provide a day a week. We want recently retired teachers to say, I can get back into the school for 2021. So this is a pandemic response. This is about getting our kids through next year back to where they would have been had it not been for the pandemic.
Sure, but the tutors, will they be full-time on the same status as a permanent teacher?
They'll be paid. They'll be paid as per teacher. These are teachers being paid as teachers. This is a professional workforce, and we need those that are recently retired or casual or pre-service to put their hand up. So that will be the workforce that we'll provide in addition to what we already have.
Will they be on contracts? Will they be casual? On what basis are they going to be employed?
So the funding will be provided directly to government schools. So the student resource package, their budget, the school budgets, they'll get additional funding. And they'll be there to employ teachers. These are teachers registered through the VIT. If their registration has run out, VIT will support them. They'll have their working with children's checks. They'll be employed for this period of 2021.
And then at the end of the year, the end of the financial year, or the end of the calendar year, that funding isn't there for
this is a 2021 $250 million boost to get kids up to where we need them to be. Now, many of those teachers, I would hope, would actually come back into the workforce on a permanent or part-time basis beyond 2021 because, our population is growing, our student enrolment numbers are growing across the state. We need more teachers. So those that may have left the profession, we get them back as a tutor. It'd be great if we keep them beyond 2021, but this is a dedicated funding boost for the 21 calendar year to get our kids back up to where they would have been.
Will there be any training as part of this if they were retired and not leave?
It would depend how long, for example, a teacher's been out of the workforce, so there might be engagement with the Victorian Institute of Teaching, there might be a little bit of training, but for the most part, this is a workforce that is ready to go. We know that there are many thousands of people that if they register on the education website, we can get them up and running and into our schools next year.
And will they be recruited from interstate? I know we do that when we're doing police drives and things, or do you specifically want Victorians?
No, we would welcome interest from interstate, of course, and we often do that with our existing workforce, recruiting people from right across the country, because there's no better place to be a teacher or a support staff than in Victoria.
Just to the Premier, President Bennett has said that mystery cases are currently low enough to significantly ease restrictions in Melbourne as planned from next week. Is the government considering pushing ahead with everything that was in the planned roadmap?
I just missed who had said that, sorry.
Catherine Bennett, the epidemiologist.
No, we're not going to be delivering the entirety of Step 3. I've made that very clear. The advice is that that would not be safe. We will, however, choose those items on that list of things that were proposed to happen this coming Sunday. Those that are safe we will proceed with, and there may be some others that we believe are safe that were not necessarily foreshadowed at that time. This is a changing thing. I know that's frustrating that not all questions can be answered and not all certainties can be provided. But at the end of the day, we're not in a position to go as far and as fast as we wanted to. But there are some things we can safely do, and that's exactly what we will do. But those decisions will be based and will benefit from detailed analysis of data that's come in today and all the data that comes in throughout the week. And those decisions will be not last minute, but they will take account of as much data as possible.
Premier, you've said that we can't open up too quickly. We're now well into our third month of lockdown, so many businesses have been forced to be closed for more than 7 months this year. We've now been told that they have to lower their expectations this weekend. It seems like this 5-case threshold is unattainable. How is this fair to businesses?
Well, there's nothing fair to anybody if you open up because you're pressured to do so and the science doesn't back it. That's not fair, because you'll be closed again. Our aim has always been clear: open at a point where you can be confident that you can stay open. No business, large or small, will benefit from being open for a very short period of time, only then to have to pinball in and out of rules and restrictions and shutdowns well into 2021. Logic tells you that. My discussions with many people in the business community confirm that. Yes, they're frustrated. We're all frustrated. We all want this to be over as soon as it can be. But we don't get the luxury of some of this commentary we've seen the last few days. Just open everything up now. That is not a fact-based, science-based approach.
Premier.
And I'm just not prepared to entertain those sorts of decisions. That's not what we're doing. The key point here, though, yesterday at some length I went to the notion that we are reviewing daily, we're reviewing weekly, what a likely outcome is in the days and weeks to come, and if upon that further analysis 5 is the new 0 and 10 is the new 5, well then we'll have to factor that in, and we will. Now I can't answer all the specifics around when that judgment would be made or what that might allow or not allow. It'll make the task of keeping a lid on this virus harder. But I just thought it was appropriate to reflect on that yesterday, given that that's what we're thinking about. We're not about keeping these restrictions on in an indefinite way unless and until we reach a target. I would remind all Victorians that there was quite a call, and we were fully supportive of it. There was quite a call to move to targets and to move to dates, and we've tried to do that, but we've always been really clear that that was the goal, that was the plan. That was not a kind of ironclad guarantee. That's not the nature of the fight we're in or the virus that we're up against.
Why is it that Melbourne is in the longest lockdown in the world?
Because we've had more community transmission than many other countries, and we are very likely to be able to basically defeat this second wave.
How do you explain that to businesses? We're the only city that has been in a lockdown for this
Well, I've had it put
time.
to me that it's the government that's taken away people's freedoms. The virus has taken people's freedom away. Be very clear. And for those who advocate opening up everything yesterday, then they ought to account for what that would mean.
But it will mean 3.5 months of lockdown isn't rushing it.
Well, ultimately, case numbers are too high to open up now. That is a fact. That is based on the best of public health advice. And if people find fault with that, well, then that's fine. But the public health advice to me, from a learned team of experts, is that it is too high at the moment to open, unless, of course, we are prepared to be open, as some it would seem are, to open for a short period of time only to have to shut down again. That is not the strategy. That's not what people want. It's not what I'm prepared to settle for. Everything people have given has to count for something, and it will count for a lot more if we see this thing through for a few more weeks and then take safe steps when they're safe to be taken. Not taken now because we all let our frustration get the better of us.
One of the issues that you've got the public scratching their heads as to why the contact tracing system, which is ultimately going to provide the confidence to reopen at whatever number, is not doing what would seem to be enough. You are not taking a cluster like Chadstone, for example, and saying what the Chief Health Officer said, even days afterwards, if you're even mildly symptomatic, go and get tested. Why not everyone who was at Chadstone? Why not close contacts? That's starting to happen at Kilmore, but why is that only happening at Kilmore? Why is it not happening elsewhere?
Well, again, people are free to criticise, but the outbreak management of each of, whether it be Colac, Latrobe Valley, Kilmore, Frankston, Chadstone, and Box Hill Hospital, people are working as hard as they possibly can. And if outbreak management were, as some describe it, inaccurately and unfairly, then I would not be standing up here saying to you 2 cases are confirmed as linked to known outbreaks or existing cases, and 9 further cases, so this is 11 of 12 where we think the 12th is not actually a positive, but someone who has got trace elements of the virus weeks after they were first infected. 9, so that's all 11, are either linked to outbreaks or existing cases, or are provisionally linked to outbreaks or known cases. That is proof positive of a public health response that is working, but it has to be a partnership, and we're very grateful to all those business owners, we're very grateful to all of those staff, family members, not just cases and contacts, but their close contacts as well, or casual contacts you might call them. This is a big team, and they're working very hard, and we're delivering well in excess of all of our national cabinet agreed metrics. But it is very challenging when you get down to very low numbers. You only need 5 or 10 cases, even if they're very well contained. And just looking at the aggregate numbers or the numbers over a 14-day rolling average can tell you a story that isn't quite accurate. And that's why I'm going to ask the Chief Health Officer to speak to this in a moment, but just a final point before I do that. We've always been very clear that we would look at the stories behind those cases. We would work as hard as we could to have an understanding and to, if you like, segment cases. So there are mystery cases where we just can't work out where the person got it. They're the most troubling. Then there are other cases where you have an idea, a very, very good idea, but upstream there's still some doubt. But downstream you've been able to isolate, test, and contain the spread of the virus beyond that. They're very different cases. They all get recorded as the same number, but they are very different cases. And recent weeks, where we've seen some outbreaks, those outbreaks have been handled very well, or we would not be reporting 12 cases a day or an average of 10. We'd be reporting a good number more than that. But these things do change, they evolve. The stuff in Kilmore is not something that we've done before, but I think you'll find that's going to be a feature, a much more common feature of outbreak management, testing in high-risk workplaces, all of those things. And there's been some commentary about testing in aged care. Well, we don't run private aged care, but we're going in there and we're testing the staff, and we're really pleased to be able to do that. On the differences in approach based on different outbreaks, perhaps the Chief Health Officer can add to my comments.
Thanks, Premier. Yeah, I would say we're following at a minimum the national guidelines for outbreak management and contact tracing, and we're going above and beyond that. We are following casual contacts, and we're asking them to test when they've been exposed at exposure sites. So we are doing an approach that is the same across Australia, at least at the minimum level as defined in the national guidelines, and above and beyond that. So the 12 cases today, 1 probably not real, and 11 linked to known cases. That means, by definition, there are no cases of unknown acquisition for today. That's what we want every day, and when we have cases who are in isolation at the time that they get tested and get that positive result, they're not going to be exposing anyone else, and so we'll see these numbers drive down.
So Rachel, can I just finish this one? So I guess the question would be, if this approach is now being done in Kilmore, where you are doing close contacts, telling them to isolate, telling asymptomatic people to get tested, why has it taken until now for that approach to be phased in as it's been described? Why was it not being done, say, in the Chadstone outbreak? I mean, if you have a look at some just back of the envelope, if you take out the Frankston-Chadstone outbreak, we would have an average somewhere around 7, and we'd probably be on track to open on Monday. So why was that not done in the case of Chadstone? Why has it taken until now?
No, we've done it in the Chadstone case as well. So people who are casual contacts of that site, anyone who's been through Chadstone, who hasn't even been to the Butcher Club, hasn't even been to Jasper's Coffee, are being prompted to get tested. So that is much, much broader than the previous approach for outbreak management. And so it is akin to the Kilmore outbreak. The issue with the Kilmore outbreak is that there is a burden for contacts of contacts to be isolating. We've got hundreds of people isolating in Kilmore. I think they accept that as a legitimate and proportionate measure to control that outbreak. And we haven't had new cases. We've had half of those get their day 11 quarantine testing. They've all come back negative. The other half will be done today. I expect that they'll be negative as well. So I think this is an approach that is as precautionary and proportionate to the task ahead of us.
Just to finish up, it wasn't done originally with Chadstone. You were saying that if you're even mildly symptomatic, come forward and get tested if you've been to Chadstone. That's not everybody. That's not close contacts. And I guess the question is, you would have had, I would guess, significant public support for an approach like you're taking in Kilmore. Why was it not done in the initial stages of Frankston and Chadstone? Why was it only in Kilmore that was started to be phased in?
So an approach of testing every single asymptomatic person who goes to a particular setting when there are tens of thousands of people coming on a daily basis is not value for money and is not necessarily a proportionate approach. We had people who were known to be positive with casual exposure in Kilmore, and so it was very clear that the epidemiology suggested that there was a very infectious person in that setting, and they had gone to that specific setting. We're talking about a number of shops in Chadstone where people hadn't gone anywhere near any of those exposure sites, and so to open it up to every single asymptomatic person would not necessarily have been proportionate. We're still saying anyone who becomes symptomatic get tested, anyone who becomes symptomatic isolate at the first sign, and we're seeing every single case that's linked to that.
New South Wales has been open for months with similar daily case numbers to what we've had for the past 3 weeks or so. What's the difference between New South Wales and Victoria?
The differences are really profound. When I spoke recently about the cases that we've had in Victoria, when we had 20,000 cases in this second phase, or wave, as is a kind of lay term that's not necessarily a technical term, but through this second wave, the 20,000 cases that occurred across Victoria settled into the hardest cohorts and populations across the state, including in metropolitan Melbourne. The household sizes I've spoken to, so average household size in Victoria, 2.5 people. We're thinking that on average, the household sizes that we're following up are 2 to 3 times that size. That means more workplaces exposed, and it goes on exponentially. Those workplaces have people working there who have households that are 2 or 3 times the size of an average Victorian household. So the number of close contacts per household and the number of close contacts they have is hugely different. And we are coming down from 725 cases per day down to our 10 to 15 cases per day. We are not building up from a trickle of a small number of cases in small households without some of the challenges of casualised work, of cash in hand, of issues of visa status, issues of language and cultural barriers. And so the challenge in Victoria is profoundly different from equivalent case numbers in any other jurisdiction of Australia.
An advisor to the World Health Organization has urged governments not to use lockdown as the primary method of controlling the spread of COVID-19. with that advice, would you consider revising the strategy?
Well, we have followed a strategy that is not using lockdown interminably. We are using the restrictions that are in place now to drive the case numbers down so that we can get to the very thing that WHO is talking about, not having restrictions in place in the long term because you can control at a sustainable level. Either, as is the National Cabinet decision and the national strategy, no community transmission, 0 cases of community transmission, that's nationally agreed, or if we can't get there, at a level of a few cases per day that is sustainable in terms of follow-up and management of the outbreaks and the contacts that we need to follow, if that's the case. So we're not out of accord with WHO advice, and WHO advised 200 countries and regions of the world, almost all of whom are not at this point, almost all of whom will need to manage a much more significant ongoing level of transmission. And they're speaking to the harms of restrictions that are in place ongoing. We are mapping out, as is explicit in the roadmap, a gradual easing to a point where we're getting to a COVID normal. So in that sense, WHO would be supportive, I imagine, of that kind of path that leads to the lifting of restrictions that allow people to have their well-being and health and psychological health supported.
How is the 5 kilometre restriction? There seems to be growing need among the community to have it expanded or removed completely. A couple of weeks ago we did ask Alan Chang how we came to the 5 kilometres, and he said that it had been successful at reducing movement, but he couldn't really give a reason. I think he said 5Ks, 12Ks, it's an arbitrary figure. So can you just talk us through why it's 5 kilometres opposed to 10?
Look, it is ultimately a decision about what is proportionate for reducing the amount of interaction from one person to another person, one household to another household. You could choose different distances. As I've mentioned previously, Israel's down to 100 metres from your home. Spain went to 150 metres for weeks and weeks on end. 5 kilometres is a judgment about where people can reasonably go for exercise, where people could reasonably go for the permitted reasons without increasing too significantly the number of other people and households they come into contact with. When you double that radius, you're multiplying by 4 times the number of households that you can potentially come into contact with. So it's just trying to make a judgment about limiting interactions to an extent possible, but allowing people to have some opportunity to find a park, find a walking trail for the purpose of exercise.
Considering people in outer suburbs and semi-rural areas with less density have fewer friends and family, not as many parks, not as many shops in their 5Ks. How conscious are you of the, I guess, disproportionate penalty that it imposes on them? Yeah,
I think that, there are so many things that are applied across the board that are more difficult and more challenging for some individuals. That's well known to us, and it's really tricky. You can't make individual rules for individual households. We've tried to look at particularly challenging circumstances. The single person bubble was trying to address that. The intimate partner exemptions were trying to address that. But I totally accept that not everyone lives in the same kind of neighbourhood. Not everyone has the same opportunities. For people who live 5 kilometres from a beach, terrific. But not all of us do, clearly. But that will be in consideration as we come to this weekend as well, as we think about that. But it's not easy.
Sorry, can we just finish the 5K then? On that point, considering that there are a lot more measures that you've got in place, like testing people in quarantine, more contact tracing, would you be pushing for that zone to be expanded?
Oh, I'm not pushing for anything. We are reflecting on all of those elements as we come to this weekend about what can reasonably change with what we're facing at the moment. So yes, it's up for consideration, as is everything.
We heard the Premier yesterday say that this could be as good as it gets in terms of case numbers. What's the inverse to that? What's the ceiling that we can really accept before cases start to get away from us, or before we start to see pockets of lockdown again?
Oh, it's a difficult judgment to make. It's clear that any country that has hundreds of cases per day doesn't do contact tracing at 100%. Doesn't matter where you are in the world. The United Kingdom that's invested $10 billion into contact tracing and has a team of tens of thousands doing contact tracing are getting to about 2/3 of their daily cases at all. Not even in a timely way necessarily. So there are clearly limits to what contact tracing can manage, but we've got a team of a size that could manage dozens and dozens of cases per day, but that is not the entire solution to how you manage transmission risk. So masks and distancing and the behaviours that people engage in routinely, keeping that 1.5 metres as they go shopping, as they buy food, absolutely critical measures in the mix. That applies across the world at the moment. It's a different way of living, and it's not easy to change some of those habits, although it's pretty clear that we've habitualised a lot of those really important things. But contact tracing cannot do the entire work of preventing transmission, because the human behavioural elements are really critical as well.
So is there a figure of where the Victorian contact tracing team starts to become overwhelmed?
No, I don't know that there is. I think, again, it's not even a question of being overwhelmed. It's a question of what drives transmission. And when you do contact tracing, you've already got a case. You're following their close contacts and you're managing their quarantine. But the risk of transmission also relates to how each and every person moves around before they become symptomatic when they're infectious, and then how they're interacting before they get notified to the department. They're things that are not within the control of any contact tracing team anywhere in the world, because they're things that happen before a case is even notified. So they are really critical elements as well.
Of those 11 cases that have been linked to outbreaks, do you have a rundown of what outbreaks
I do. So one's a household contact of a known case in the Chadstone outbreak, so obviously in quarantine. One linked to Estia Keilor aged care. 7 linked to a case from Box Hill Hospital outbreak, including 4 cases from the same household. 1 is being investigated for links to the Chadstone outbreak, a separate one. 1 with links to Uniting Agewell in Preston. And the last one, I'm presuming, is the Geelong case that the Premier alluded to. I think that's residual virus, probably dead virus, still gets picked up with the viral fragments on a swab, but isn't infectious. But we need to be clear that it's not a reinfection. They're rare events. They can happen for people who've been previously infected. So there'll be a review by an expert panel of that today. But I'm pretty confident that will be regarded as a residual infection and won't be counted in today's numbers.
Just Box Hill. Sorry, got the same question as me probably. Box Hill, is there healthcare workers in that 7?
No, I believe it's household contacts of cases in Box Hill.
Just on the Box Hill outbreak, doctors have said that hospital is still without some critical infection control measures. How is that still possible, given we're so far into this pandemic response?
I don't know that that's the case. It might be a claim being made, but I don't know that that's the case. As I said previously, our Chief Medical Officer, Andrew Wilson, is the lead for clinical settings and PPE, infection prevention and control. I think he spoke on radio this morning. He might be able to provide some additional details. But the support to health settings by our health services pandemic leadership team and all of the guidance absolutely covers the requirements for healthcare settings to manage infection prevention and control.
There is suggestion that the COVID ward and non-COVID wards are actually sharing the same tea room without it being cleaned in between. Has that been raised with you?
No, it wouldn't be raised with me, as I say, but it might have been raised with the Chief Medical Officer, and we can come back to you if there's information about that.
Brett, do you know how we're going at the moment with turnaround times, getting to close contacts, getting the interviews done, getting those test results back? Is that...
Yeah, no issues there at all. Turnaround time is at 96-97% for pathology tests to come back. So the vast majority of people, will, if they're tested in the morning, will get it the same day. Everyone else will get it the following day. So that's fantastic. A number of them are, within a 12-hour window. So that's fantastic by our pathology services. In terms of contact tracing, from time of notification to time of making those phone calls, the vast majority are being done within 4 hours, let alone 24 hours. So no issue there. The challenges will be the time that people take to get tested and the people that might be exposed in that period of time, and the time that people are isolating from becoming symptomatic. They're really critical things.
You're still concerned about that aspect of things?
I am. Look, any public health person in the world would say they're really important measures to reinforce, because they are much harder to control after the fact. You've already exposed people, they're incubating, they can become positive down the track, and it gets away from you in that sense. That's when you get 10 people in a household who are becoming positive, even though you've done contact tracing with the case immediately, because they've already had 3-4 days of exposure. So that makes it very challenging. So I will continue to reinforce that message. Isolate immediately on symptoms, and for everyone to be aware that there's that $450 payment if you have to take time off work because you're waiting for a test result, and there's that $1,500 payment if you have to isolate or as a close contact have to quarantine for 14 days.
Professor Sutton, it's just been confirmed that New South Wales has recorded 13 new cases today. That's more than Victoria, but we're still in lockdown.
So the circumstances in New South Wales are very different. They have prospectively followed a small number of cases over recent months where they've looked forward to the contacts that they have and managed them appropriately. If we had started with a few cases that were not really complex households, that were not really challenging circumstances, we might have been able to approach this very differently. What we had was 20,000 cases over several weeks that have come down to a very low level, but the remaining chains of transmission in Victoria are some of the trickiest, I imagine, in the world.
Can you understand why Victorians are starting to lose faith in this strategy? I think everyone was so understanding that we had to go into a tough lockdown when we were getting so many cases, but now New South Wales is more than Victoria has. It's so frustrating, and it's just been so many months. And
there's no question it's frustrating. I'm frustrated. Everyone is frustrated. Yes. I'm not sure that people are losing faith.
Like there's a light at the end of the tunnel. Like this, we're all looking to this weekend.
So the roadmap, I would say, is the light at the end of the tunnel. The fact that we are reviewing,
we're not taking the full step
the fact that
Sunday.
we're reviewing the case numbers every single day is an important thing that Victorians would expect of us. That we make judgments about where we're at, so that we're not taking an unreasonable risk that we're going back to restrictions, or that we're needing to reimpose, or that we're going to get to hundreds of cases a day by Christmas. Victorians would want to know that we have the confidence of being able to keep numbers low or drive them down to extremely low levels right through as a sustainable and long-term issue. There's no question there's frustration. There's no question that people are hurt and harmed by the restrictions that have been in place. But the roadmap is laying out a pathway to easier and easier ways of living at the same time as managing case numbers. I think that's really critical.
But the roadmap also has its problems. It said that we'd be getting to 5 cases by Sunday on average, and we're not there. So why are we following this roadmap that has targets that are not attainable? So
as the Premier has already spoken to clearly, the roadmap was requested. The roadmap was a desire for people to see what the modelling demonstrated, what the kind of targets were for us to make decisions. The fact that we might at some point have looked ahead of it, at points looked on track, at other points looked a bit behind, is the reality of this virus. And we have to make judgments about the number of mystery cases we're getting and the rolling average. And if we're not at that point yet, and that represents an unreasonable risk for us to take, then we will alter the changes that we need to make. We will make decisions that are safe and steady, but we will always keep in mind doing the most that we possibly can to open up in a safe way. Nobody wants this. Nobody wants restrictions that are in place if they don't need to be. And so we will always look to lifting that, but in a way that doesn't put everything that we've done at risk.
Just in terms of the mystery cases that are current at the moment, were you aware, or do you know how old or how young the youngest is?
In terms of age of those individuals, I don't. I can come back to you with that. There are 2 new mystery cases, not from today's numbers, but that are finalised for today. postcode 3024, so that's Mambarin, Mount Cottrell and Wyndham Vale, and 3025 Altona North. So as I've said previously, it doesn't mean test here and don't test anywhere else, but anyone who's symptomatic in those postcodes, there are chains of transmission around you. You should get tested if you have any symptoms whatsoever. Just a scratchy throat, just a runny nose, any fever, any new cough, get tested.
Are you aware of any children in those mystery cases?
No, not from these numbers, but I don't have the details. I'm sorry.
Where are they up to with the suburban contact tracing hubs and setting those up?
Yeah, they are developing well.
Are all of them up and running at this point?
Yeah, they are all up and running. They need to develop in line with the maturity of that setup, and so the allocation of cases to them has started. But they're not all equally linked into community health centres or community-led bodies, and so they need to establish some of those links, because it's that community-led engagement that's really critical for those suburban public health units. But
when do you think you'll be able to say that you're confident that those links have been made?
Oh, I think it's up to those health services that are helping to establish them to make that judgment. I think they're always going to say that they can work to have more extensive and better established community links, but it's a work in progress. I think they all understand how important it is to have that level of engagement in the public health response.
Brett, what's the timeline from someone becoming infected to when they then become infectious and when they show up test results?
So a person can be infectious up to 48 hours before they develop their first symptoms. This is why masks are really critical, and this is why some people get exposed to someone before that individual has symptoms. They are usually most infectious just before those symptoms start and for the few days afterwards, the first few days afterwards, but they are potentially infectious up to 10 days after symptoms begin. But usually in the first few days they are most infectious. That's when most transmission occurs, day 1, day 2, and in the day or 2 previous.
And how long from point of infection or moment of infection to becoming infectious?
A moment of exposure to becoming infectious is that incubation period, and that's 14 days. That's why people are quarantined for 14 days, because from being exposed, the longest period of time before developing symptoms is 14 days.
Question for the Premier.
Sure.
Can we ask about bushfire risks and whether we've missed the window for adequate backburning?
No, I don't believe so. We'll have some more to say about the forthcoming fire season quite soon. There is very significant rain events forecast for spring. There's also the Bureau, I think, affirming in some of their assessments about the nature of the summer. It'll still be a risky time, it always is, and we'll have all the detailed planning, whether it be fixed wing, rotary, retardant, all the other important steps that we take. We'll get people into their properties where they need to do that to clean up as soon as we possibly can. We're doing some detailed work on that.
What about the reports that CFA cannot assist property owners currently under the current plan, even in regional areas, if they request help with backburning?
I'm not sure what CFA are doing in relation to that matter. I can have someone from CFA speak to you though.
Premier, just friends in regional Victoria, business chambers have written to you. I'm not sure if you're aware of the letter, are concerned about upcoming public holidays and events like Melbourne Cup and Grand Final, concerned that people will ignore the rules and gather. Are you aware of those fears and advice as what to do about that?
Well, obviously, regional Victoria have low case numbers and we need to keep it that way, and that's why there are significant limits on the number of people who can travel to regional Victoria and the reasons that they can do that. There are very significant financial penalties if you flout those rules, and you will be caught. The vast majority of cars are being pulled over and they're being asked whether they have a lawful reason. At the same time though, I want to thank regional businesses for the great job they've done. The fact that we haven't seen outbreaks, the fact that we haven't seen really significant increase in the number of cases is proof positive that we're open and people are doing the right thing, both customers as well as businesses. In terms of upcoming weekends, there will be a significant enforcement. There will be very significant presence, whether it be people checking that businesses are doing the right thing or police checking that individuals are doing the right thing. All of us, if we want all people in regional Victoria, if we want to keep regional Victoria open and indeed take further steps, then we all have to take this seriously, and we all have to acknowledge that just as we get a benefit from it, all of us, we've all got to play our part.
Just in terms of Sunday's announcement as well for regional Victoria, are you considering anything with regards to indoor pools? There's been outcry from the disability sector that they're missing out on hydrotherapy
Yes.
and that sort of thing. Was that in consideration for this?
It is. There was a question asked yesterday. I'm not quite sure where the follow-up got to, in particularly in relation to Public Health has provided advice that for hydrotherapy patients and clients, they can go and use those pools. It would seem that there's some resistance, or just hasn't actually happened on the ground. A number of hospitals may have a different view. I think we're chasing that up. We want to make sure that when the public health team says something is safe, that we then follow it up to make sure that it's happening, particularly for people who need that therapy. It's all about pain management. It's all about many reasons why. It's not just therapeutic. It's also about part of a daily routine, and notions of trying to connect with other people and trying to be safe, but trying to get as close to normal as possible. Let's come back to you on whether we've been able to achieve that.
You said in your statement following Chris Eccles' resignation yesterday that, quote unquote, until last night I had understood that Mr. Eccles did not know if he had telephoned Mr. Ashton. Isn't the issue of whether or not that phone call had been made could always have been cleared up with phone records? Chris Eccles reported directly to you. If you really wanted to get to the bottom of who made the decision to put private security guards in hotel quarantine, why wouldn't you have asked for those phone records yourself?
Well, I'm not conducting the inquiry, Rachel. The inquiry's been conducted by a retired judge.
You're the head of the government, and you've said you
I'm
wanted
well aware
answers
of that.
to these
I'm
questions.
well aware of
though.
that, and I don't think you want the head of any government essentially interfering in the work of an independent judicial inquiry. I also take you to Mr. Eccles' evidence, where he made it clear that he had made a search of his records. I think he might have made some points about how complete they were not known to him. But my statement yesterday was simply honest. I was not aware of it before the Sunday evening, and the appropriate action was taken. Mr. Eccles resigned his position the following morning.
Do you think
Can
the inquiry-
Victorians have
You go,
faith
Rachel.
that the hotel quarantine inquiry really is being frank and fearless in its investigations, given it took media reporting and public questions for them to take the pretty obvious step of requesting those phone
You'd need
records?
to speak to the inquiry about that.
Yeah.
But I have confidence that it's getting about its business, it's doing its work, and I think it's going to provide a thorough and detailed report.
You've also said repeatedly that you're ultimately accountable and responsible as head of your government for what goes on. So far, you've let your health minister and your departmental secretary take the fall for the hotel quarantine program. You're still here. What gives you confidence that you should remain as Premier, given you've said that two of the most senior members of your team did the right thing by resigning?
Rachel, I don't run from challenges. That's not who I am. And if that's not clear to you, then you perhaps don't know me particularly well. But the Victorian community know that I am not someone who runs from difficult things or hard work. And that's why I'm here, and that's why I'll continue to work as hard as I possibly can for the Victorian community. That's what I was elected to do, and that is what I'm absolutely focused on.
Premier, what about taking accountability for the failures of hotel quarantine?
Well, my accountability is very obvious. I want a report to be handed down, and then I will take the decisive action to make sure that these sorts of mistakes can never happen again. I'm not doing any cut and run here, just in case any of you are in any doubt. I will get on and get this job done. That's who I am. That's what I was elected to do, and that will not be changing. That will not be changing.
Okay, your government set up hotel quarantine and it's failed. As we know, it's led to the second wave. We're now in lockdown. Nearly 800 Victorians have died. You're the Premier. Surely accountability looks like resigning.
Well, you can have a view, and you can advance that view as often as you like. That's not my view. My view is you don't run from difficult tasks. You don't run from challenges. You get on and get the job done. That is who I am. That is what I am doing. And that position will not be changing. What's more, the board has not yet provided its final report. Let's wait and see what the board reports. And many of the assertions, many of the claims, much of the commentary may be correct or it may not be. let's wait and see what the board comes back with.
The IBAC Commissioner has written to the Board of Inquiry to outline the additional risks that could occur within the public service during times of crisis, such as the pandemic. One of the things that the Commissioner has said, however, is that they've been saying this quite a long time, that they are under-resourced, considering that you're handing out resources to multiple agencies and bodies to deal with these things. Would you commit to giving the funding or additional funding to IBAC in order for them to make sure that the public service didn't have any corruption issues during this time?
Their budget has increased year on year. There's a budget process at the moment. There'll be another budget next year and the one budget the year after. And we consider all of their requests in line with many other requests that we receive. It'd be wrong to suggest that they don't have a budget that is larger than it was. And I think there might even have been, if memory serves me correctly, and I'm happy to be corrected if I'm wrong, but I understood that the last time I looked at this matter there was a very significant underspend. Money had been allocated to that body and they had not in fact spent it. But again, we go through that process every year. This year will be no different.
You appreciate that they have flagged that they will need additional resources to investigate, considering
I don't appreciate that. I've not seen that. You're raising that with me for the first time. I'm happy to have a look at it. But let's be clear about this. There's not an agency out there of this nature or any nature that doesn't argue every year for more money. That's the nature of these things. And we consider those matters every year, and this year will be no different.
The Inspector General of Emergency Management's inquired into pretty much every major crisis in Victoria since 2014, I think, from the Wye River bushfires to our more recent bushfires to thunderstorm asthma. Have you asked, or will you ask the Inspector General of Emergency Management to conduct an inquiry into our public health emergency management preparedness for the pandemic?
I've not asked for that yet, but I've got no announcements to make. He's a standing officer in that he performs those functions in a pretty routine and regular way. Again, I've got no announcements to make on that. I think we might wait until, of course, we've got past this before we start looking at some of that work. That's the usual way that the IGEM functions.
Even if some of those lessons could help us now?
Well, I think that there are many lessons, and many of them have been learnt along the way, and there is a culture of continuous improvement. I'm not ruling that out. I'm not wanting to give you the impression that decision's been made, because I don't believe that it has.
Premier, just on the subject of fines,
yes.
A number of people haven't paid their fines, a majority in fact. Is there any leniency for those people who are not paying their fines?
No. If you want to avoid a fine, follow the rules. It's very simple. And there are many more warnings that have been issued than fines. Many more warnings that have been issued than fines that have been issued. And the easiest thing, police have been fair about this. If it's a genuine mistake, if you were trying to do the right thing and you perhaps didn't understand the rules, many thousands, tens of thousands, perhaps hundreds of thousands of warnings have been given. But if you've been issued with a penalty notice, you've been issued with a fine, then you need to pay the fine, and we will come after you if you don't. There's too much at stake here. There's too much at stake, and many of these fines, if not all of them, are the result of choices that people have made, and they are the wrong choices. They are unsafe choices. They can potentially be deadly choices. So fines are important, rules are important. Let's not have those people, though, detract from the vast majority of Victorians who aren't getting issued with fines because they're making the sacrifices, they're staying the course, they're following the rules, and they're driving these numbers down. That's the most important thing.
Just on fines, in the first lockdown, so we're not talking about the second lockdown, first one, Victoria received more than $2 million in revenue from fines compared to the rest of the country. So we've handed out the most amount of fines, but it didn't really stop Victoria from having a second wave. So why are the fines so much if the strategy doesn't really help?
Well, I'm not sure whether the comparison takes account of different levels of fine, for instance. I'm not sure whether that's a comparison about dollar value versus the number of infringements that were issued.
It's both. Victoria handed out more fines.
I don't have that data in front of me. I don't have that data in front of me. I think it just doesn't make any sense to indicate that enforcing the rules hasn't worked. We're not 750 cases. We're 12, an average of 10 for the last 14 days. There's no good having rules.
First lockdown.
Well,
So when Victoria and New South Wales were in the same position, New South Wales didn't hand out nearly as many fines, and and they weren't as high as here.
Right.
So why is it that the fines have gone up if it's...
Maybe I misheard you. I thought the question was, why was there a second wave?
Well,
I need to understand the question and not to answer it.
How effective is it having $5,000 fines? It just doesn't really seem to have helped our position with managing coronavirus here.
I don't accept that analysis. I don't think that's got much of a basis in fact at all, actually. The number of people going to regional Victoria is less than it would otherwise be because there's an on-the-spot $5,000 fine. If that's not obvious, I don't know what is. The question was about whether the fine should be paid, and the answer is yes. And we will pursue people who don't. Simple as that. The rules matter. The rules are what are driving, and the amazing performance of Victorians. That's what's driving these numbers down. I'm not, frankly, interested in doing some analysis, which I don't think is fair, on what happened in New South Wales 6 or 7 months ago. This is right now, and the numbers are coming down, and that means on Sunday, despite commentary, despite, lots of different stuff, these are the facts. Sunday, we're going to take some big and important steps. Are they everything we'd like to do? No. Will we get there? Yes. And you know why? Because Victorians are staying the course. They're getting tested as soon as they've got symptoms. They're following the rules. Some aren't, but the vast majority of Victorians are, and I am proud of them and grateful to them. And I think we have every reason to be optimistic about the changes that will be able to be made on Sunday. Not I think, just banking that or not paying any regard to the journey we've been on, how far we've come. This has not been easy on anybody, but we've just got to see this thing through. The alternative is we'll be open, yes, but we will not be open for very long.
Media reports that the budget is locked in for November 10. Can you confirm
That's not correct.
Can you tell us when it is?
When we are ready to make that announcement, we will.
Premier, are you concerned at all about the motion, the vote of no confidence in the Parliament today?
Cheap politics does not work against this virus. Cheap politics does not work against this wildly infectious virus.
The opposition
If it did, then those who are completely irrelevant would have a much greater part to play.
Apparently there's some unnamed Labor MPs that the opposition leader is urging to cross the floor. Do you think that'll be happening?
Well, he's not relevant to the work I'm doing, nor are his urgings. Again, I just make the point, he and the cheap politics that he trades in is of no consequence when it comes to fighting this virus. His cheap politics is not a vaccine against this virus. I don't know that I can make it any clearer than that.
Did you see the flags start yesterday? Do you have any thoughts on that?
I'm sorry, could you repeat the question?
791 flags that were laid out.
I thought there was another word in your original question.
The stuff.
Did you call it you called it a stunt? I don't respond to those sorts of issues. They're not relevant to the work that I'm doing. We're about saving lives. We're not about playing cheap politics. Because it just doesn't work. It just doesn't work. It doesn't work. When the rules come into lockdown, you want to open up. When you're opening up, you want to lock down. This back and forth, not an epidemiologist amongst them, not an expert amongst them. It's all about them. It's all about their benefit, not the Victorian community's benefit. It's all about politics. And politics just doesn't work. I'm not concerned by it, I'm not interested in it, and I won't be playing it because it doesn't work against this virus. Victorians see through it too, I think, frankly, and that's why people know that if we're going to keep these numbers low, we have to get them low. If we're going to stay open, then we need to be very careful about how we open. That's what Victorians get and understand, and they're not too interested in people playing politics out of tragedy and people pretending that politics is a vaccine against COVID-19.
The amendment that David Davis is trying to get through, would you treat that in the same vein?
I've not read his amendment, and I've long since, or perhaps never, been a predictor of what happens in the Legislative Council. We'll see how that runs. We're having very productive discussions with the crossbench, and we'll wait and see how that bill goes.
Do you know much about the investigation at the into potential transmission at the Royal Melbourne Hospital?
No. but we can come back to you if we need to.
Thank you.
It may be a little bit early, but I understand that there's some children that are starting
Seems quite
to make
late, actually.
Halloween costumes at school or discussing
Well,
it.
someone read this. The other day I answered this, and then people went off on a tear that I had somehow, it was a slip-up on my part, and I had somehow let the cat out of the bag, that restrictions would be on for longer than the roadmap said. Can I freely confess, I don't know the date of that particular
of Halloween.
US festival, I think. But in any event, people who celebrate it, they're free to do that if you want. I cannot tell you what the date of it is. If you want to acquaint me with what the date is, I'll then answer your question.
Can they go
Pardon?
trick or
When is it?
treating?
October 31.
Right.
You're not going to dress
Looking,
up
they're
as
all.
the Grinch
No one
this
can
year?
see here, but they're all looking at me as if I should have known that. I don't know that date. I don't know that date.
The question is, can,
Now I
can
do.
children
So,
go trick or treating?
should they be able to?
Well, will they be able to?
There'll be announcements made Sunday. I don't know that particular festivity will be central to our considerations, but I think that people will be able, to the extent they need to interpret the rules and work out what is appropriate on the 31st. If that's something that they're interested in doing, there's no Halloween plan, if I can put it to you that way.
This year, Premier?
Pardon?
Your costume this year? You won't be the Grinch?
Dress-ups are not really what I'm about. Others are into that. I'm not. Surely I have exhausted all of your questions today.
I have one for the Deputy Premier, if that's
Really do need to
okay.
get to Parliament though.
Sorry, it'll be quick.
No worries.
Just on Nazareth College in Noble Park, it's indicated on the website that it's still closed. Is that the case?
Yeah, that's as I understand it, and that's the normal process. Once the team at DHHS go in and do the contact tracing, it's usually around 48 hours. Sometimes, if it's a bit more complex, if the school's very large and the deep clean takes a bit longer, usually it's around 48 hours. So yes, I'm not surprised that today's the start of the second day.
All good. See you tomorrow.
Thank you.